Okay, well, welcome everybody to the Indianapolis video conference, the Indiana Dressage Society's third webinar of 2022. And today we're very blessed to have Janelle Renschler presenting on acupuncture, manipulation, myofascial therapies for the dressage horse. Again, it's the third in our series of educational programs and educational webinars, and we're happy that you signed up to be part of this. So if you don't know who we are, if you're not a member, the IDS, the Indiana Dressage Society, is made up of adult amateurs, instructors, youth, backyard horse owners, students, all sorts of individuals who just basically love their horse and are interested in dressage as one of the disciplines to help train your horse and show and go to competitions. So if you aren't a member, why not join us? The Indiana Dressage Society, we are you. I'd like to give a special thanks to the IDS Educational Committee for all their hard work making these programs a reality. Mike Dawson, our IDS president, myself, vice president and education chair, and the following directors who are on the education committee: Barb Levy, Bonham McHuston, Michelle Sirocco, Deb Rockefort, Linda Kimball, and Dana Jones. All that hard work, and not just on these programs, but all the educational programs that IDS brings to its members. So we have some ground rules, and this makes it work a little better for everybody. We're going to mute everybody's microphone so there's no audio interference. There's nothing worse than trying to hear our speaker and hear conversations or dogs barking in the background. If you have a question, simply hit the raise your hand button on the bottom of your screen, and we'll open up your microphone for you to ask the question, or we can actually wait until the end of the session where Janelle will actually go ahead and have a bit of a Q&A session. We ask that you not record this presentation, but we are recording it. And if all works out the way we plan, it'll be available on the Indiana Dressage Society's YouTube page. So Janelle Renschler grew up in Northern Indiana and was a horse lover from a young age. She received her veterinary degree from Purdue University and went on to earn her PhD in laboratory medicine at the IU School of Medicine. She had a passion for equine integrative medicine in response to her own horse's problems and ultimately channeled this energy into a career shift. Today, she uses a whole horse approach to patients, incorporating acupuncture, manipulation, myofascial kinetic lines, biomechanics, hoof balance, and recently dentistry, with a focus on client education and the root cause of problems. Dr. Renschler focuses her writing on dressage, classical in-hand work, and positive reinforcement training, with a goal of development to complete, with a goal to complete a development on, she has a goal, I'm sorry, to develop and compete in working equitation. I think a word got moved over somehow. That happens, I guess, when you're in a hurry. Sorry, folks. The learning objectives today: a broad overview of acupuncture and manipulation, theory, mechanisms, indications, contraindications, risk, and various practitioners, fascia, related therapies. Another learning objective will be to understand myofascial kinetic lines and the impact on movement. And finally, dressage-specific issues in the myofascia. So with that, what I'd like to do is turn this over to Dr. Renschler, and we look forward to hearing what you have to say. Thank you.
Okay, let me share my screen. I'm not seeing, Mike, I'm not seeing the show. Here we go. Okay.
There we go.
Okay,
Perfect.
great.
Looks good. Perfect.
All right. Well, thank you, Ken and Mike and IDS for this opportunity to speak. This is certainly my passion now, and I'll talk about acupuncture manipulation and myofascial therapies for the dressage horse. And Ken already listed my objectives, so I'll just move right into the presentation. So what is acupuncture? I think we all kind of know it's sticking needles that are very thin in defined points. I'm going to go over how that actually works and when you might use it. But this is a practice that's very old. So it was developed in traditional Chinese medicine. So supposedly thousands of years ago. And so you can see this cartoon on the screen. And this is actually pretty accurate. So this is probably how they figured out that these things work by accident. So, and actually you might be able to affect the neck by sticking some needles in the leg. So that's kind of right on there. So even though this practice is really old and it's part of traditional Chinese medicine, or TCM, or you could call traditional Chinese veterinary medicine, TCVM, there's an emerging evidence basis for this. So the practice really has a scientific basis now. And the training that I undertook for acupuncture was a scientific medical acupuncture course. So we really didn't discuss the other aspects of traditional Chinese medicine, like the tongue and pulse diagnosis and those things. So we really focused on the scientific basis. And I think there's a lot of discussion. You know, I hear people say, well, I don't know if I can believe in acupuncture. And I say, well, it's not really something you can believe in or not now, because there's a whole evidence basis for this now. So there's a group, evidence-based acupuncture. If anyone is interested in looking at that, they have a website. And this is focused on humans, but they've accumulated all of the evidence from that. And I just checked, and there are over 37,000 publications on PubMed for acupuncture. So there's a lot known about the mechanisms now. And if you look at the evidence basis, so now for Medicare reimbursement for humans, chronic low back pain has enough evidence that they will pay for that as a therapy. So it is becoming more accepted. It's used for post-op nausea and vomiting. My husband is a human anesthesiologist, and so they actually trained them at one of the national meetings on acupuncture for the post-op nausea and vomiting. And then just when we look at how animals respond to acupuncture, they really can't have a placebo response. So it's pretty obvious to me when I see a response in an animal that they can't have that ability to have a placebo. So, it's interesting. If you watch them, there definitely is an effect. So for the mechanisms, I'm not going to get a lot into this, because if anyone is really interested in the science, you can visit the evidence-based acupuncture website. But what it's doing is, we call it neuromodulation. So we're impacting nerves in some way. And that can lead to muscle relaxation and impacts on the fascia, impacts on internal organs. There is a known release of endogenous opioids and neurotransmitters. This purinergic signaling pathway is known to be involved. changes in brain functional connectivity and parasympathetic stimulation. So basically, if you look at this diagram, the point on the hand is a commonly used point called large intestine 4. And so if you stick a needle in there, you can impact the nerves going to the spinal cord, going to the brain, and then it can go in the reverse direction as well. You can impact organs. So like this point on the leg is stomach 36, and this is one of the commonly used points as well. So by needling that, there's crosstalk in the spinal cord, and that can affect nerves going to the organs and vice versa. So if an organ has a problem, it can impact the surface of the body is the basic mechanism of this. So after I've said all of that, a lot of people explain acupuncture by saying that you're manipulating energy or chi, as it's known. So that was kind of the way that acupuncture was historically explained before they knew anything about any of these mechanisms. And so I would say that I am not moving chi. I focus on it from a scientific basis. So that's just me. There are many other practitioners who might see it differently. And there's certainly a wide range of training in acupuncture. So the points in acupuncture, these are going to be the same whether you practice traditional Chinese medicine or scientific acupuncture. So the points are used in all areas because they work. So what is a point, and what is special about it? So they're really anatomic sites. So you have to have a thorough knowledge of anatomy to be able to find the points and to be accurate with it. So there are 14 different channels that these points can be on, and they're mostly named for internal organs, even though they don't necessarily relate to that organ, but that's just kind of how they were named. So like this is the large intestine channel that I'm showing in the photo. So you can see it goes from the face down the neck and the forelimb. So these points are mostly at sites where it's an important nerve or vessel site or kind of along fascial planes. And of course, when you think about veterinary acupuncture, horses and dogs and other animals have different anatomy than humans, even though comparatively we kind of all have the same parts, but different arrangement. So how did they transpose these points to horses from humans? So there were some early veterinary acupuncturists in the 1970s who kind of decided where the points should be on the horse and kind of modified over time. And again, there's some discrepancy with older texts, and not everyone agrees exactly where the point should be. And then of course, horses don't have fingers or toes, right? So we have a lot of important points on the hands, and so horses really don't have those. So yeah, that's just something we have to deal with. So what happens when you put a needle in? Pain relief is one thing. You can decrease tension. And if there's a nerve imbalance, so if it's either functioning not well enough or too much, you can modulate that nerve, and you can cause a relaxation response. So that's more parasympathetic state, and you can enhance immune function. And so as far as indications for acupuncture, I think mostly in the horse world, we tend to use it in performance horses just to maintain their myofascial health. So, you know, prevent and treat back pain, neck pain, lumbosacral SI issues, with the goal being to try to prevent compensatory problems that you might get hock arthritis or suspensory desmitis or something if you don't maintain them well. And so that's the vast majority of the work that I do with it. But sometimes I get to do other things which are very interesting. So I've treated a case of facial paralysis and head shaking, and infertility is one that I've also been treating a mare for that. And I think there's a lot more opportunity for using it for infertility, but a lot of people don't know about that. And then increasing gut motility. So there's a point that's really useful for treating non-surgical colics, and you can really increase gut motility. Since I don't practice conventional medicine, I don't get called out for colics. So I really don't have much opportunity to try that, but I would be willing to if somebody wanted me to try. So as far as the safety for acupuncture, it really is pretty safe. The main thing that you might encounter is if a horse grabs a needle and ingests it. Needle breakage can happen, and that's more common if you needle into a really tense area like the back, and then the muscles spasm, and so it can actually bend the needles to 90 degrees, but you can still get them out the vast majority of the time. So I haven't had a needle breakage occur, but that can happen. And then perhaps injury to underlying structures really isn't too much of a big deal, but again, you have to know the anatomy so you're not needling in the wrong site. And then, of course, if there are other things that you can do with acupuncture, like aquapuncture is injection of a substance in an acupuncture point. So then you would need to use a standard hypodermic needle to inject B12 or steroids or iodine or whatever. And I really don't do too much of that because I don't like the idea of injecting something like that. I don't think it's really necessary, but a lot of people will do that. People will also use gold beads to implant in acupoints, and I would say definitely no to that idea because you're putting a foreign body in there and leaving it. So I will not do the gold beads. And so some contraindications to acupuncture, there aren't a lot. I mean, you know, you're obviously not going to be needling around an open wound or fracture. Pregnancy, there's some caution for using certain points with pregnancy because you can increase uterine motility, and so you might cause premature labor. But even in humans, it's really not that much of a concern. It's just there are certain points that in traditional Chinese medicine were known as forbidden points during pregnancy. Okay, so now I'll talk a little bit about veterinary medical manipulation, or also known as veterinary chiropractic or veterinary spinal manipulation therapy. And so that kind of varies based on where you did your training. Also the legality of using the term chiropractic, because that's a human term. And so certain states will not allow you to use that term for animals. So this is using a high velocity, low amplitude thrust. So kind of a low force, really fast motion in the plane of a joint to restore normal joint movement. So it's just a reflex muscle relaxation. You're not moving the bones or trying to put bones back in place that were out. I think there's a lot of misunderstanding about that. But again, with this, you also really need correct training and knowledge of the anatomy. So what is manipulation doing? So you will find when you palpate a joint, and it takes a long time to learn what is normal joint motion. So you're finding a joint restriction, I would call it. So it's just not moving as well as normal. Some chiropractors will call that a subluxation. And then the adjustment that you do is going to restore the normal joint motion by stimulating some receptors. So if you look at this diagram, basically with a joint, you have a certain amount of movement. If you try to actively move it, like if you take your finger and move these joints to their maximum, well, you can move it a certain amount actively. You can move it more passively. And then you would reach a point where you would move it so far that you would breach the limit of the anatomy. So with manipulation, you're trying to quickly move this into a very small space between what you could passively move the joint to and where you would actually breach the anatomic barrier. So that's the theory anyway. So once you get a joint moving again, then you'll have better function. Chiropractors also like to talk about a vertebral subluxation complex, which means that restrictions in the spine can actually impact internal organs and vice versa. So, there's some idea that you can impact internal organ problems with chiropractic therapy. So indications are, pretty much the same as for acupuncture indications. So neck, back, and pelvic pain, performance issues, gait issues, girthiness, difficulty bending. Anytime there's been a traumatic incident like flipping over, and then just general maintenance. And as far as the safety of manipulation, I would say it's probably a little more concerning with that than with acupuncture. So if you don't know what you're doing, so there are layperson chiropractors out there, or lay people performing chiropractic, I should say. And so if you're not going in the plane of the joint and you don't know the anatomy well, if you're using too much force, then you could actually cause, a ligament disruption, luxation situation. You could cause bruising. In extreme events, you could cause fractures. Paralysis would be more of a concern if, for instance, if a horse had a neck fracture that nobody knew about, and then they tried to have the neck adjusted, and this person did not do a neurologic exam, and could actually cause severe damage. So contraindications, kind of like with acupuncture, if there are infections at a site or fractures or acute injuries, you probably wouldn't be trying to adjust that. If you have potential cervical vertebral instability in a horse, or if there's hypermobility in a joint, And actually, a lot of the warm bloods now, which this is an issue in dressage, a lot of them are hypermobile because, they have fancier gaits. And so that could be an issue if you try to adjust the hypermobile joint. So again, it's like why you want an educated person doing this and not just anyone. And so that brings up the law in Indiana. So actually right now in the Veterinary Practice Act, all complementary and alternative therapies are included as the practice of veterinary medicine. And they specify acupuncture and chiropractic in another part of that is included in complementary and alternative therapies. So this is kind of a gray area with human chiropractors because there's nothing in our chiropractic act saying that they can work on animals. It is specified as humans. There is training for human chiropractors that is about 200 hours, and they can take an exam to be certified as an animal chiropractor, but it still isn't recognized in our state. In many states, they have to work under referral from a veterinarian, but we don't have that set up in Indiana. So I know that there are a lot of them working in Indiana, and I don't think that the state is pursuing them for the illegal practice of veterinary medicine. So I know they're also lobbying to try to change the laws. So if, something may change, but this is the way that it currently is. But I think it's more concerning that there are still lay people practicing chiropractic. And so why you would not want to have that done, because the training programs now all require either a DVM or a DC to do the training. So if someone is not qualified to enter one of those training programs, then they don't have the training, that they need for this. And they also have no liability and no licensing. So if they work on your horse and they cause harm, then there's no recourse. Usually less educated people tend to use more force, and so there's more risk with the procedure. And again, they can't perform a neurological or lameness exam because they really aren't trained on that. So again, more risk with that. So now I'll kind of shift gears and get back to talking about fascia. So fascia is really interesting, and it's become kind of a hot topic. And so this is really the common link between acupuncture and manipulation and all these other therapies. So what is fascia? If you think about, if you have a piece of meat and there's kind of a white covering over it, that's fascia. But fascia is also found throughout the body, encompassing all of the nerves, vessels, organs, bone. It's really everywhere. It's continuous connections in sheets. It's considered to be an organ now of its own right, and it has communication mechanisms. So it's really cool. And so you can get tension in the fascia from things like trauma, stress, inflammation, surgery, poor posture, which, that can be with us or it could be with the horses. And fascia has a huge number of receptors and free nerve endings. And so here is how acupuncture can affect the fascia. So I think I said before, acupuncture points tend to be located along some fascial planes. So when you put a needle in a point, going through the skin to the underlying fascia. What I will do, so you normally twist the needle a bit as it goes in the skin, and that actually is known to cause a better response from the needling. And so that is known as the Dirchi reaction. And so the needle actually is grabbed by collagen fibers in the fascia. So there are free nerve endings here, and basically acupuncture points have maybe a higher concentration of these, and they have a higher number of mast cells. And there's a whole mechanism that I kind of cut off the bottom of this diagram, but this just shows you when the needle goes in and it twists, then you can release tension throughout that area. Now, this brings up another thing. So there's another concept called dry needling, and you can do dry needling at any area of the body. So that's not at an acupoint. So if there's like a trigger point in the body, you could stick a needle in there and you can have kind of the same effect. But acupoints themselves may have a more intense effect anyway. And so dry needling can actually be done in humans by physical therapists and athletic trainers, but they can't do acupuncture. So it gets complicated. So along with an acupoint exam, we actually do a myofascial exam. So that encompasses a little bit more than just testing acupoints for sensitivity. So I look at the whole body for areas of tension, heat or cold, texture changes like some grittiness or spasm in the muscle. And then also look at sensitivity at specific acupoints. So there can be an association between point sensitivity and either local issues or distant issues. And that's where acupuncture is really good at finding issues that you might not recognize otherwise. So this would be perhaps on the pre-purchase exam. You can definitely pick up things that would not be found on conventional exams. So if they're just going to flex the horse and take radiographs, that's going to find obvious things. But as an acupuncture practitioner, you really develop a much better feel and the ability to pick up on sensitivities that wouldn't otherwise be known. So in my mind, I would say like having a myofascial exam done on a horse that you're looking at buying. So, for instance, in my acupuncture training, there was one of the surgeons at Colorado State who she does some work outside of the university. And she was saying she does a lot of pre-purchase exams for dressage owners. And she, tells them, don't buy this horse, don't buy this horse. and it gets difficult because she's, quote, failing a lot of them, but then they know for sure when she finds one that doesn't have those kind of issues on the myofascial exam that one's going to be good. So it's almost like cheating the system, So when you look at point sensitivity, you could pick up on patterns like, for instance, if this horse has stifle pain, there can be sensitivity at a point. Bladder 37 is in the hindquarters and stomach 10 in the neck. And so that seems to have no relationship to the stifle, but you learn these associations, and then you can say, like, you know, this is consistent with possible stifle pain, and then look a little bit closer at that. And you can look for organ issues. So there are these stomach ulcer points, which I think with ulcers, I mean, there maybe is a little bit too much made of that, but there definitely are alarm points for the organs that you can pick up on. And then some neck points can indicate distal limb issues. So, is somebody's microphone on? I don't know. Okay. Okay, so, you know, along the lines of myofascia, so, you know, I've talked about how acupuncture can affect the myofascia, and manipulation can do that. Other things can be used, and I use most of these. And so it's great to have a whole array of tools in your toolbox. And so myofascial release, so that's what I'm doing here in this photo, or Masterson method type work. Acupressure, so sometimes I'll just use pressure on a point, or T-touch. T-touch involves maybe like the circling or vibrations, and that definitely impacts fascia. You can use a laser on points or just on the tissue in general. And then you can use the PEMP therapy. And so, you know, the thing with most of these, so it's probably faster to use a needle to get the best effect for the fascia. So a lot of these are either like less specific or maybe less effective, but you have to look at the horse and that individual and what they respond to as well. And so that's why I use a lot of different things based on the horse. So sometimes they're too reactive for needles. Some of them respond really well to laser. So yeah, you just have to base it on how that individual responds. And then electroacupuncture is just using an electrical current through the needles. And that, I have another slide about that coming up. Osteopathy is another form of manipulation therapy that's really focused on the fascia and relationship to internal organs. So on the surface, it's kind of similar to chiropractic, but different ideologies, I would say. I'm actually beginning as a student in osteopathy, so and kinesiotaping is another thing you can do. And I love taping, and I do that a lot after I work on horses to maintain the effect. So that's what you can see here. This will stimulate receptors in the hair and skin, so you can impact the fascia that way. Okay, so laser therapy. So I have a laser that's a multi-radiance. It's a class 1M laser. So there are different classes of lasers. The class 4s can generate enough heat that you can burn the retina. So those are, you have to wear eye protection for. But mine is like this one, where it's, it definitely works, but it doesn't require eye protection. So, so what laser is doing, I think there's a lot of confusion about this as well with light therapy in general. So we call it photobiomodulation. So it's light affecting living tissue. So there are just tons of different devices. You have to know your device and the wavelengths and the frequency and the power output. So it's hugely complicated. You can have, light in different wavelengths. There's a different color. So you can have red light in 600 nanometer wavelength, or infrared light is more like 900 nanometer wavelength. So people will talk about LED therapy or infrared therapy. I'm sure you've all heard of these various things. So that's just based on the wavelength, right? So laser itself is coherent photons of light, like in this diagram. LED light is incoherent, so it spreads out more. So basically, the laser is coherent so it can penetrate the tissue better, whereas LED, those devices are much, much cheaper, but they only work well for really superficial things because they just don't penetrate as well. So this infrared therapy that you hear about could be either LED or laser light. So that's the basis for that anyway. And what does light do for the fascia? Because I think people are really confused about that. On the surface, it doesn't really seem like it should be doing that much, but again, kind of like acupuncture, laser therapy has had a huge amount of scientific publications, and so much is known about the mechanisms now. And you almost need a PhD to understand how it's working. So I'm not really going to get into a lot of the mechanisms with that, but it's kind of impacting the mitochondria. So you have increased ATP, increased nitric oxide, which can increase blood flow. So you can decrease inflammation with the laser. You can also relax tense fascia in a similar way to needling. Now, a lot of the small animal practices now have caught on to laser as a way to reduce anxiety in dogs and perhaps cats that are nervous when they come into the clinic. So, you can see, like, if you just laser down their back, it can relax them. And so it's a similar thing for horses. And I'll tend to use the laser a lot on horses that are too reactive to needle into their backs, and maybe they have back spasm or back pain. And so it definitely helps a lot for that. It's also good for wounds and soft tissue injuries. But you have to know your device, like I said, and you don't, it's really complicated. And so I think it's a little concerning to me that there are a lot of practitioners out there, like body workers, who are lay people who have a laser device and maybe a class 4 device. And so they can be actually causing harm with that if they don't understand it well enough. So you just have to, judge, like, who are you having do this work, and do they actually know what they're doing? Electroacupuncture, I mentioned before, is running a low current through needles at 2 acupoints. And this is a good way to increase the effect of needling. So this is really the best thing for pain control if the horses can tolerate it. Also, best choice to stimulate nerves. So when I've treated facial paralysis or infertility or things like that, then like this example here is a mare who's being treated for infertility. So I'm using some points that can stimulate the uterus and ovaries there. Now, there's the concept of myofascial kinetic lines, and this came from human work by Tom Myers' anatomy trains, if anyone's familiar with that. So just in 2015, these lines in the horse were published from some Danish veterinarians. So these are continuous networks of fascia throughout the body. So they basically dissected horses and found the same kind of myofascial lines that humans have. So, you know, there's continuous fascia in all of the lines shown on here. And now they actually have published some other deep lines as well. But these can really help to explain movement dysfunction in people and horses. And these Danish vets also do acupuncture. And so they've published certain release points for all of the lines. And they usually use acupuncture needles to release these. And so I've been trying some of these because this is really new work, but I do find that it's working. And this is really good to help to explain some movement in horses and movement dysfunction. So one of the really common issues that I see is in this line called the superficial dorsal line. So this comes from the pole through the neck and the back, the hamstrings down to the flexor tendons. And this is very close to the bladder channel in the horse. So I know like the Masterson method has the bladder meridian technique. And so if anyone has done that, then that's, you know, the same area that we're talking about here on the back. So, you know, issues in this. So if there's any tension anywhere along this line, then you can see other, you know, fascial restrictions and tension along the whole thing. So, you know, let's say if there's a saddle fit issue, then you've affected the middle of this line, and you could see perhaps, you know, trigger points back here in the hindquarters. You could see pole restrictions. And then if you had somebody come along who's a chiropractor who doesn't look at it quite this globally, and they say like, well, there's a pole restriction, and they adjust that, but maybe they haven't you know, looked at what was the cause of it to begin with, and looked at the distant issues. Now also with these, so you can see, since the flexor tendons are involved here, so if you had a horse who had underrun heels, and so they have very low heels, and there's more tension on the back of this line, they can have trigger points up here, they can have back spasm, they can have neck pain, you know, anywhere along this line, it can affect that. And also, so if the horse has a dental problem and they have a TMJ restriction, then again, they can have back pain, they can have issues throughout this whole line. And so this is really explaining the basis for this hoof and body and hoof and dentistry connection. So this is the kind of horse you would see that has a restriction in the superficial dorsal line, where it's got a dropped back that's really tense, head up, you know, an anxious horse. You can kind of see the whites of its eye. And then under saddle, you know, you probably see lack of propulsion, you know, this horse isn't going to bend well anyway. But this is the kind of horse that you also might get some bucking or something under saddle. And again, this might originate from saddle fit or feet or teeth or whatever. There's another dorsal line, the deep dorsal line. But this one, this is the kind of horse, if this line is not working, horse is stiff as a board, right? So you're not going to be able to bend this horse at all. And that is because usually there are some small stabilizing muscles along the spine called the multifidus. And so for some reason, these are overactivated, leading to this stiffness along the whole spine. And then going up to the pole, you can see, so there's that connection. So with this kind of a horse, they can't flex at the pole, which that's known as C0 for the occiput, or the first, you know, to the first cervical vertebrae or the atlas. So they can't flex there, so they rotate their head instead. So, you know, if you're trying to get them to flex at the pole, they can't do it. So some factors that might cause this issue to begin with would be maybe starting a young horse that doesn't have good balance yet. They have a weak core, you know, restarting a horse for riding that, you know, has poor balance. If they've had recent trauma, or maybe if they have pathology in the facet joints of the spine, so an older horse. So the body is trying to stabilize the spine with something like that, and you get tension on this line, and then yeah, and then you have the problem. I just lost track, sorry. But anyway, so when you're trying to resolve this, so it's going to be treatment, you know, the therapy like acupuncture, manipulation, but also doing core training for a horse like this is going to be important. And I often talk to my clients about doing core training with the horses because it's just so beneficial, but especially for a horse with an issue in the deep dorsal line. And then I often use these Surefoot pads, which are our balance pads. And so as the horse is standing on pads like that, there's a very small sway in them, and it's activating the proprioceptors, which are, that's the sense of where we are in space. And so that can help to develop balance as well. So another line is superficial ventral line, you can see here. And this one is starting in the extensor tendons of the hind limb, coming up through stifle, you know, along the abdominal muscles, sternum, and then up to the mandible. So you can see if this is tense, overly tense, the horse is going to be more flexed. So the back is going to be more up because there's tension down below. So this isn't really something riders complain about too much. But this can be a horse that can't extend well. So you can, you know, if you're having difficulty extending the trot, then maybe this is an issue. And this is the kind of horse that might tuck the head behind the vertical more, or they might be girthy when when you're saddling them because they get tension around the sternum here, and that often causes an issue with girthiness. And then another line is the deep ventral line. So this is a really interesting line because it connects to the internal organs and it has a complicated path, but it really goes around all of the internal organs. So diaphragm is involved. The psoas muscle is involved up here. Now, a horse with an issue here could have more anxiety because this involves the sympathetic ganglia in this area. And so they can be in more of a sympathetic state or fight or flight. So also horses with issues in this deep ventral line, so they can have general neck stiffness, difficulty flexing at the pole, difficulty with lateral bending or extension, the bucking issue under saddle. For the psoas muscle part of this line, it can cause a slight rise in the lumbar musculature, which I see that fairly commonly in patients. Also, because the diaphragm is involved, it affects the venous drainage. And so they could be more likely to have stocking up in the hind limbs. And then because the hyoid is involved, they could be more likely to have their tongue out. And so that's something that you definitely don't want to have in a dressage horse. So, if they are carrying their tongue out to one side, then they probably do have a hyoid restriction. And so this line could be involved in general, but that's something you would want to have someone look at. Okay, and then the lateral line is involved in side bending of the body. So this is like the horses that have a hollow side and a bulged side. So the hollow side is the more tense one with this lateral line. And then you can get a lack of muscle development in the neck. So in the splenius muscle, and you can kind of have a dip in front of the withers. So this is a common pattern that I see as well. So you can look at the horse and they don't have good musculature in front of the withers, kind of like the upside down looking neck. And this particular case example is from the recent book that was published by the Danish veterinarians. So they just showed treatment of this line and then core exercises and rehab and what it did for this horse specifically. But I think we all see this kind of a horse a lot, and it can be a challenge to fix that, but they probably have restrictions in the lateral line on one side. And so the functional line is something I see all the time issues in. So this rotates the spine. And so this explains if there is a hip or pelvis issue on one side. So you'll see crossing the back pain leading to opposite shoulder and or lower neck type restrictions. I see pelvic restrictions so commonly in horses, lots in dressage horses. And then they'll have sensitivity at one acupoint right here called SI9. So they usually have a shortened forelimb stride, especially on that leg where the effect is. They can have stifle issues because this line also involves the stifle. Sometimes you can see stumbling in the front limbs because this area near the shoulder is where the brachial plexus is. And so if there's tension there, it can affect that. And then difficulty with lateral movements and canter lead opposite the line can occur. Okay, so just in general with dressage horses, I guess, you know, what I'm seeing in most of them is overuse injuries. So they kind of develop micro damage over time, and they're trying to compensate. And then at some point they can't compensate anymore. And the areas that tend to be problematic are pole restrictions, lower neck restrictions. And this is especially if they're ridden kind of like behind the vertical with the neck in not the optimum biomechanical position. Also, I see a lot of back pain in them and a lot of pelvic restrictions. And then if you look at a horse, you can look at it, the musculature, and you can see what their movement history has been recently. So we've got this horse here, and you know, from a distance, it looked like it might be a fancy warm blood, okay? But you can see this, there's a lot of tension in this neck. So this should not be visible as much as it is. There are tension lines here in front of the scapula. And so this is kind of underdeveloped under here. So I would say probably this horse has some neck issues and or has not been ridden properly. So I think if you learn to identify these things, you can see what might, you know, you can just be a detective about what the horse's history has been and whether it's been ridden properly or not. So one specific thing for dressage, so when the horses are learning piaffe, and so they have to really flex at the lumbosacral junction to do this. So they're kind of you know, putting more weight on the haunches. And if they're not adequately prepared for that, so they're doing a lot of piaffe early on, they can actually strain the iliopsoas. So this is the primary hip flexor, and it has to be working to engage this lumbosacral junction. And what you will see in that point is, you know, some back pain, maybe spasm, stiffness in the hind end. You can see that slight rise in the lumbar musculature. You can see a resistance to collected work. So if you're starting to train piaffe and you see these things, then call in someone like me. So you know, you can do acupuncture. There are psoas stretches that you can do, and then treating this deep ventral myofascial line. Half pass is another thing where to do the half pass, the pelvis opposite from the bend has to be able to rotate down. And so I would say, like, this isn't a huge amount of rotation down in the pelvis on that side, but there is some just demonstrating, you know, what has to happen. So if they have pelvic restrictions and they can't rotate the pelvis down, then you're going to really be struggling to get the half pass. Also, doing this exercise can create restrictions in the neck or pelvis. So it simultaneously causes the restrictions, but having those restrictions before you start doing it can also make it difficult. And tempi changes. So with this, again, the pelvic restrictions, lower neck restrictions, that's really going to make it harder to get the tempi changes. And so some of these things you might be struggling with, you know, they might be training issues, but they might also be physical issues. So if you're having problems with these things, then have an evaluation done. And so for maintaining the dressage athlete, I would say find a practitioner that has a detailed knowledge of equine anatomy specifically. So whether that's someone like me, I mean, some body workers, I would say, have a really good knowledge of equine anatomy. And so, you know, have some type of therapy like this done every 8 weeks during the active training and showing season. Because if you wait until there's a problem that you notice, then it's going to be worse than if you just try to keep up with this maintenance. Core exercises are really critical. Even if you, you know, think you don't need them because you just ride your horse to keep it in shape. Doing specific core exercises are going to help you. So that could be on the ground or it could be ridden exercises. And then you can learn some basic body work techniques to do on your horse. So it's not that difficult to do many of these things. You know, you're not going to be learning acupuncture or manipulation, but you can do some massage or just learn how to evaluate your horse's body. So there are some courses out there for owners. And then learn correct biomechanics to help your riding and training. So the biomechanics and the training are another way to help the fascia. So it's not just what I can do, but it's what you can do on a daily basis to keep your horse in as good a shape as possible. And then, of course, good farriery and dentistry are essential to this whole picture. And I think everyone knows that, but they don't really be able to accomplish that. So every single day I see feet that have too long of toes or underrun heels or other issues, and it's affecting the horse greatly. And people are investing a huge amount of time in training, in saddles, in showing, like every other area. And what they really need to do is to have better farriery. And so I just can't stress that enough. Like, it's critical. And the same thing with dentistry. And that's why I'm adding dentistry to my practice now, because I feel it's so important that I want to be able to balance the mouth of these horses that I work on with the body. So now I can take any questions if anyone has any.
So let's see if we have any questions here. So I have one. You know, it's a, Janelle, it's a, you mentioned the horse with a sort of when you try to bend them to the side laterally and they end up with a head twist versus the, you know, having their frontal plane on a more vertical basis. What's a good therapy for that?
Well, there's usually an occiput restriction when that's going on. So that's where that would be an indication for calling your acupuncturist or chiropractor and have some work done on that. And then then the horse will be able to flex at the pole again. And then you can, you know, work on your training to keep that going.
Is it worth x-raying them first?
Well, I mean, they don't usually have trauma that causes that. So it's more of the, you know, the micro trauma over time. But I guess if you knew that a trauma had occurred, then you might do that.
I was thinking more like arthritis, you know, that kind of situation.
Oh, like arthritis. Well, you know, that's not really that common at the occiput and atlas. So, you know, arthritis is more common in the lower neck. So I guess I probably would not do that unless they weren't responding to treatment or, I think, but the first step, I would say, probably just have the horse evaluated by somebody who could look at that.
Good. Do we have any other questions? I know it's a little late. It's almost 9:13, but do we have any other questions while we have Janelle on the line? Dr. Renschler certainly has a lot of experience, and I'm sure we would benefit from any of the questions you might have. I'm sure she can provide some excellent answers.
Yeah, so anybody feel free to unmute yourself and ask a question. Dr. Renschler, I had a question about, you mentioned learning some of the simple bodywork techniques. That's something that I've tried to do with my horse. Can you kind of give a brief overview of how an owner might become better in those sort of things? From grabbing your horse out of the stall to starting curry comb or posture prep or whatever your process is going to look like. How would you work with your horse on a day-to-day basis to try to improve their performance?
Mm-hmm. Well, there are courses for owners. For Masterson method has courses for an introduction to that for owners. The Equine Institute is one I know that has body work for owners and trainers. So if you wanted to do something like that, that's a good intro that can help you. Like for instance, with the Masterson method, you can just do the bladder meridian technique where you kind of hover over the back muscles, and so it's actually pretty easy to get them to release tension from that. So if you do that, and then you start to recognize what is normal for your horse, and then if you see like a change, then you can first of all try releasing the tension yourself, or then better when to call in somebody to look at your horse for further treatment. But also, like, beyond the body work stuff, I think the core training is really beneficial. So before you ride your horse every day, you can do some basic neck stretches. You can engage the core by doing like the sternal lift or belly lift, lumbosacral rounding to get them to flex at the lumbosacral junction, basic things like that. So on my website, I've got a number of resources with different books and things like that, online courses that you can do with things like that. I did see, if anyone is attending Equine Affair in Columbus, so the guy Simon Kokaza, who I had the photo of his book on core training in the presentation, he's going to be there at Equine Affair, so you can go and see him and learn some things if you want to. What else? The Surefoot pads are great. So you don't have to know very much to use the pads. You just have your horse stand on them, and they often release tension in their body from standing on the pads. And then you can also learn, some in-hand work for horses, and you can do that, maybe just 5 or 10 minutes of that before your ride every day. So there are a variety of resources for that. Corrective exercises by Jack Ballou, I've used those before. So, you might take certain days to do some other types of exercises like cross training over poles, going out and using some natural surfaces like hills. So, if you have the ability to do that, that would be helpful as well.
Yeah, thank you. I just I posted a link to that page on your website in the chat here if anybody needs it.
Okay, well, it's 9:18 and I don't see that we have any more questions. So what I'd like to do is please give a big thanks to Dr. Renschler. Also, I'd like to just remind you all to tell your friends about IDS webinars. Stay tuned for the next educational program. The educational committee will be working to come up with new topics. And if you have topics that you would like to hear, please send an email to me and we'll be happy to look into them. So with that, again, thank you, Janelle, and thanks everybody for being involved. And have a good night.
Thank you. Good night.
Thanks.